Hey, I wanted to do a super quick recording just of what our practice looks like. This is our space. This is not our very first space, but it's where we are now. I'm just gonna go in and front entryway. This hallway is kind of our administrative hallway, and then this hallway is our clinical hallway. We have a waiting room, which honestly doesn't get used all that much. We have two different therapists, a speech language pathologist and a play therapist who are in our space as well. And so it's mostly their parents that are waiting in the waiting room rather than ours. We got the books, we got the fish tank, we got the coffee machine, and then I'll just show you our exam rooms. This is kind of a little annex room that is just kind of overflow that we don't really use. These are our main exam rooms. This is the first one, this is the ocean one. We have IBCLC and a CLC on our team. Our nurse practitioner is a IBCLC, our PA is a CLC, and so we do lots of breastfeeding work, and so that's why that cool little chair is there. This is the next room, which is the farm room. The rooms pretty much look similar, like we just have the table, the chairs, the little area with the exam stuff. This is the safari room, same sort of setup exactly. Our speech language pathologist has a room here where she does speech, feeding, literacy, all of that. So she has a ton of stuff in her room. We have this room here in the back, which we use for consultations where we don't need an exam room, things like a autism evaluation, or just a nice place to sit and chat if it's more of a visit where we're talking through different things or consulting rather than needing the child there or just wanting to have a little bit more of a comfy space. And then we have a play therapist too, and this is her space where she does play therapy, so she's got all the toys. This is where we have some supplies. So down there is like ear piercing and the eye scanning machine, weights and heights. This is our nurses area. So there's the clinical hallway. This is our nurse area. We don't have a full-time nurse right now. We have a part-time nurse. Honestly, this area doesn't get used a ton from a sitting perspective. And then this is our kind of our workroom. Or vaccines, Vax Care setup, just all the regular sort of supplies that one would need, from medications to syringes to lab stuff, just like all the boring sort of stuff that you would think of when it comes to running an office. We have a ID Now machine that we do our strep and flu and COVID and those sorts of things, and then just more storage up here. Let's see. And then we have like a break room or a kitchen. And so we have a dishwasher, which was a huge win for us so that we don't have coffee cups. Bathroom. We have a conference room where we meet every day. We do like a daily huddle and we talk to our patients here and have the occasional meeting here. My office. This is a office for our nurse practitioner, PA, and then our play therapist, and then office manager's office. And that is our practice.